Good morning, everyone. Camera, there we go. Good morning. Good morning, everyone. I just want to alert you to the recording. This session is being recorded and it will be sent out to media. So please feel free to govern yourselves accordingly. We will not be editing, so it will go out in its entirety. And we will be starting on time this morning. Hopefully, we'll be able to wrap things up a little bit early. But if not, please stay and enjoy the conversation. Welcome to Racism as a Public Health Crisis. I would like to introduce the Healing Through Policy team and thank them. Thank you all for your amazing support and participation and ideas. I'll start first with the One Love Global team. Thank you so much, Danielle Williams and Catherine Westall. And I just saw Jakila pop in from Peace and Prosperity Youth Action Movement. Yes, you will notice that this invitation actually came to support young people and their priorities and their agenda. That's why One Love Global is here. That is what we do. And we invite you to join us in that process. And I am going to pass it to Dr. Shoyinka to introduce her team.
Good morning, everybody. Again, as Angela, thank you very much. I am Nikesh Shrinka. I am the Medical Health Officer at Ingham County Health Department, and my team is here. I am going to toss it over to Ann Barna to introduce herself, and then we'll just go around the room until all the ICHD people have introduced themselves.
Hi, my name is Ann Barna. I'm Deputy Health Officer for Administration with the Ingham County Health Department, and I will toss it over to Amanda Darsh, please.
Good morning, I'm Darsh, she, her pronouns. I am with the Ingham County Health Department as Innovation and Planning Manager, and I will pass it over to Dana.
Good morning, everyone. My name is Dana Watson. My pronouns are she, hers. I work at Ingham County Health Department as our Health Equity and Social Justice Coordinator. Thank you.
Thank you, Dana, and thank you for modeling that for Pride Month. My preferred pronoun is love, she. I will also do she and her. And I will introduce next or invite Ryan Rowe to introduce himself on behalf of Michigan Public Health Institute.
Good morning, everyone. I'm Ryan Rowe. I'm the Institutional Equity and Community Partnerships Manager for the Michigan Public Health Institute, and I was asked to speak on behalf of MPHI and our CEO, Dr. Renee Branch Kennedy. It's good to be with you.
Thank you, Ryan. And let's kick it on over to our partner from LEAP.
Tony on mute.
Oh, yep, we're gonna have to add him.
There we go. Can you guys hear me now? Perfect. Good morning, everybody. My name's Tony Willis. I'm the Chief Equity Development Officer at LEAP, which is the Lansing Economic Area Partnership, which is the region's economic development organization. And I'm honored to be here to talk to you about what it looks like to have a prosperous economy for all.
Thank you so much, Tony. And I'd also like to invite our partners who were not able to join, Tajmika Torak from the Firecracker Foundation, who has been working with us for the past year as well. And And thank you so much, Elaine Hardy from East Lansing. Your voice and contributions and ideas are certainly appreciated, and we thank you for your commitment to this work in service of our region. Welcome again, everyone, to Racism as a Public Health Crisis, a call to accountability and recommitment. We're going to just take a quick look at our agenda so that you see what the flow is. You'll hear from me quite a bit, so I'm going to try to get through this part a little more quickly. And as you can see, you're going to hear from the Ingham County Health Department, from Michigan Public Health Institute. You'll hear more from our team at One Love Global and from LEAP. And we are going to invite any municipal partners who are with us to then provide updates. And what we're sharing is our role in this work. What we have been working on since the initial racism call to action in June 2020. We are 4 years to the day. We chose to have this on the 4-year anniversary of that initial call to action, where many municipalities declared racism a public health crisis by issuing a resolution and or moving forward with some level of action. This space is really focused on making sure that we're communicating with as many people as possible. So again, this recording will be going out to the meeting. We had a similar conversation last week with the Lansing People's Assembly. And again, want to thank our community for just continuing to show up. 4 years later, we're still in this conversation. Any questions about agenda before we move forward?
All right. Good morning, everyone. Danielle Williams, Operations Manager here at One Love Global. We're going to kick things off this morning with our labor, life, and land acknowledgement. Basically, it's a formal statement that we make before an event that acknowledges the Indigenous communities that originally inhabited the space in which the event is taking place, as well as the human costs associated with the economic development of it. So we're going to start by taking a deep breath to the count of 3. Deep inhale. 1, 2, 3. And exhale. 3, 2, 1. The land on which we inhabit is physically situated in the original ancestral homelands of the Ojibwe, Odawa, and Potawatomi people. We pay respect to all Indigenous people, past, present, and future, and their continuing presence in the homeland and throughout their historical diaspora. Deep inhale on 3. 1, 2, 3. And exhale. 3, 2, 1. We pay homage to those who were stolen from Africa, placed in bondage, falsely named as chattel, and forced into labor, who were called slaves, but never submitted as such, who have been fully human with an unbroken connection to the divine and to each other. We honor our African ancestors for the still unpaid labor, which built what is now the Americas. Deep inhale. 1, 2, 3. And exhale. 3, 2, 1. Before I pass it back to Angela, I just wanted to go over the touchstones, which is basically an established set of mutually agreed upon principles that guide how we treat each other and be with each other during dialogue. So you want to make sure that you're 100% present, extending and presuming welcome, extend kindness, listen deeply. Know that sharing is always by invitation. No fixing. Please suspend judgment. Identify assumptions. Speak your truth. Respect silence. maintain confidentiality, and when things get difficult, turn to wonder. Back to you, Angela.
Thank you, Donnie. I just dropped in the chat the question of which one of those touchstones resonates with you. I know we moved through them a little bit quickly. Can we back up one slide? I do want to just pause there just for a little bit because this is so important. We have some of the most challenging conversations in these spaces. They tug on our hearts. They sometimes bring up memories and experiences that may feel uncomfortable. And these touchstones guide how we want to be together. And I really want to emphasize this because we're inviting people into a process, and these touchstones ground us and remind us when we start feeling uncomfortable, when we are feeling that kind of tension inside, to come back to the touchstones to remind ourselves of how we want to be in community and in relationship with one another. Thank you all. Extend kindness, identify assumptions, turn to wonder. Yes, I've had to learn that practice, listening deeply. Yes, respect silence. Identify assumptions. This is so great. All right, well, we're going to have a chance to listen deeply. We're going to have a chance to practice all of these touchstones today. Thank you, Tanisha. Speak truth and respect silence. Yes. So we're going to have a chance to practice this. All right. Thank you, Donnie. Again, acknowledging first and foremost the Lansing residents from the entire region who have continued to show up. A lot has happened in 4 years. The call to action, if you were a part of it, was a virtual call to action. It's been viewed by over 160,000 people. It ignited what has become the Lansing People's Assembly. And again, we want to thank everyone who has participated in an assembly over these past 4 years, because without your energy, your input, your ideas, your love, and your passion for this community, we wouldn't be here right now. And again, thank you to the Ingham County Health Department for your long-term partnership. Our partnership, One Love Global and the Health Department, dates back to 2008, which we'll talk a little bit more about as we get into the presentation. Thank you to the Firecracker Foundation for walking deeply with us and anticipating what a racial equity accountability process might look like. Thank you to Michigan Public Health Institute. Sorry for the acronyms here. Michigan Public Health Institute and Dr. Renee Kennedy and Ryan Rowe, who's here representing MPHI today. Thank you so much, Tony Willis and Bob Trezise from LEAP, for your steadfast support and partnership throughout this entire TRHT process and really understanding what our economy could possibly look like. A big shout out to the National Collaborative for Health Equity, which has supported One Love Global and our partners at Ingham County Health Department and the entire Ingham Healing Through Policy team through the past year of examining what kind of policy transformation we actually want to accomplish together as a community. And to the American Public Health Association for your investment, your guidance, your technical assistance, and of course to our funders, the De Beaumont Foundation, I shouldn't say our funders, funding in National Collaborative for Health Equity and the entire Healing Through Policy process, as well as the other communities of practice that we're involved in. The Truth, Racial Healing, and Transformation work continues to be held by National Collaborative for Health Equity with the support of the Kellogg Foundation And thanks to our new partners, human impact partners, you'll hear more about that as we move forward, if not today, in the future. But absolutely excited for their support. And again, acknowledging everyone who has taken the time to show up here this morning for this really important conversation. So we're just going to get into it. How did we get here? How did we get to, because it's more than just 4 years ago. Something was happening that led to the call to action. There was a global uprising against police brutality and global reckoning of white supremacy. There was a COVID pandemic and lots going on, but we didn't just jump into action at that moment. There was a lot of foundation that led to our readiness to be able to respond to that moment. It's not an accident that 8 municipalities in our region were ready to respond. And this is why, because in 2008, the Power of We Consortium, which at the time was held by the Ingham County Health Department, and the Community Coalition for Youth was one of the 12 coalitions of the Power of We Consortium. And it was through a data project that the Ingham Change Initiative was born. When we looked at data, and this is actually how I came into the Lansing community from Detroit, was actually heading up the Community Coalition for Youth and One Love Global supporting Ingham Change Initiative on the background. And the data demonstrated what the Dellums Commission report had identified at the federal level, at the national level, that boys and young men of color were at the very bottom in terms of the worst outcomes across every system. The Dellums Commission's reports, and I'll shout out to Willard Walker and Paul Elam, who really brought the Dellums Commission's reports into the community that led to the Ingham Change Initiative, and to Dr. Clarence Underwood for serving as the chair of that commission. It has sunset, but it actually provided a solid foundation of bringing together multi-sector partners and leaders to tackle one of the most complex and also one of the most challenging issues in our community to kind of get our arms and minds around. Looking at policy, specifically in how policies produce inequitable results for children of color, we discovered it's not just boys. In addition to that data, we looked at the data on, well, it's not just data, it's what was actually happening in our community. At the same time as we were getting a handle on the data, there were a series of youth homicides, young people who were victims of gun violence. And as a community, we came together with promoters and artists, institutions. Michigan State University supported us, making sure that we had refreshments every week. And we just created a safe place for kids all summer. There's a nightclub out on South Cedar that used to be called Fahrenheit, and the venue and level 2 before that, and the owner opened up that space for us to be able to make sure that children were safe throughout the summer. And organizations from all over the community came together to what we called a summer of edutainment. So they learned about all kinds of issues. They had a chance to just fellowship and enjoy one another. And it's actually how the Peace and Prosperity Youth Action Movement was born. There were young people that came out all summer and they wanted to continue. They wanted to go deeper. And we piloted with the Ingham County Health Department a Health Equity Youth Academy. And that Health Equity Youth Academy gave life to the Peace and Prosperity Youth Action Movement, which is now in its 15th year and actually has a chapter in Detroit. These partnerships across institutions were so instrumental in our community embracing the idea and the conversation and the commitment to racial equity. So much so that multiple partners came together, from the Community Foundation to MSU to Ingham Great Start Collaborative and our parent organizers, NEON, coming together for the Lansing Early Childhood Equity Project. And again, that was another Kellogg-funded project that actually is informing the work that we're doing right now, organizing with youth, with teachers, with parents, and understanding that it's the community that holds the stories behind the data that drives the work. Those collective partnerships are why we were so ready when Verge Bonero said, One Love Global, let's do My Brother's Keeper, let's accept the challenge. We were the second region, because we came at it as a region. We were the second region to come to the table with a plan. We accepted the challenge, second in the country, plan ready, and have continued to serve in that capacity with My Brother's Keeper Michigan and Girls Equity Network across the state. So Lansing was second, and then other communities in Michigan also took the challenge and started working together to look at state and federal policy. In 2014, the 20th Century Policing Survey was sent out by Chief Yankowski in partnership with our network to find out which police departments in the region were actually planning to adopt any of the recommendations that came out of President Obama's 21st Century Policing recommendations. We surveyed the community, and Chief Yankowski sent out the survey to the police. We held a series of conversations in community comparing the results from what police said they were going to do and what community wanted police to do. Unsurprisingly, miles apart. We continued to learn from our institutional partners, and thanks to community mental health and MSU and the health department and LPD, Lansing Police Department, and others who actually participated in taking the Harvard Implicit Bias Study, who actually took the Annie E. Casey Racial Equity Organizational Assessment. We were already doing this work before we were invited by the Kellogg Foundation to apply for a Truth Racial Healing and Transformation grant. Again, those invitations came to the city of Lansing and the city of Flint, and we organized the team and we headed out there along with Kalamazoo, folks from Kalamazoo and folks from Battle Creek who became TRHT Michigan. So we are a statewide collaborative that is one of 14 places and dozens of universities that are doing TRHT work. So again, in 2020, June 3rd, community call to action. We approached Mayor Andy Shore and asked him to declare racism a public health crisis. He agreed to do so if we got Ingham County on board because, as you know, public health lives at the county. It lives inside of Ingham County and Ingham County Health Department. And I want to thank Dr. Shoyinka for showing up and for saying yes. And also to the community and to everyone who participated in that, I just want to thank you for your patience, for your grace, and for continuing to lean into relationship. We don't always get it right. And one of the lessons that I have learned, and this is my moment of accountability, is that when we stop talking, we lose the ability to grow together and build together. So I'm here making a recommitment to listen, to learn, and to love more deeply. And out of that commitment is the Lansing People's Assembly, who month after month after month for 4 years have made it clear what a safe community looks like and what we need to do together to actually achieve it. We believe that the Ingham Breathe Act is one way to get there, and that is the substance of how we've come together over the past year and how we'll continue to move together to get more people involved in co-creating the policies that we need to transform our community. All right, that was a lot. That's a lot. Like I said, we didn't just jump into this 2004 and in 2020 because it was the craze around the country. We committed because we were already doing the work. And we knew that we had the commitment and the capacity to go further and to really embrace the tension and the head and the heart work that's going to be necessary for us to get there. All right, next slide. And welcome again, everyone who's hopping in. Just a refresher of Truth, Racial Healing, and Transformation Framework. If you have not been involved in TRHT, welcome. No time like the present. So over the past, 7 years, we've evolved. You know, we started off with these teams, and we're going to set these goals. And we realized that all of these things work together. There's 5 main pillars of TRHT, and they actually work together. Narrative change. You may have noticed that disinformation is actually one of the most destructive forces in our ability to come together as a people, to unite on anything, and to actually restore the idea and the realities and the practices of democracy. So the TRHT framework lays out narrative change, what's happening in our schools, what's happening in our media, what's happening in entertainment. If you're like me, you grew up on TV shows that had very distinct messages about what groups are in, what groups are out, who can be trusted, who can't be trusted. Social media has exploded that impact. So another way that we get to meaningful policy change is through our relationships. It's been a journey in this past year of bringing this team, Healing Through Policy team, together, us getting to know one another. One Love Global has a long-term relationship with Ingham County Health Department, and with the city and with other institutions. Leaders change. It requires new relationships. Sometimes it feels like it's starting over, but it's really important. It's really important for us to have that history, for us to hold that knowledge, and to be that bridge through those transitions. It's our commitment to long-term relationship and leaning into that relationship that allows us to dig deeper into what keeps us divided. So the separation pillar is looking at all of the ways that segregation continues. Housing, health, arts and culture, immigration, and education. We added philanthropy because it's another way. Philanthropy is another area where some privilege continues to perpetuate inequity. And we had some challenges even just getting the TRHT grant to the community. And we just decided we're going to face this head on and learn how we can come together to rethink and bring philanthropy with us in this process. Law is a huge pillar. We took a deep dive there. I'm not going to go deep into the power of prosecutors and the prosecutor reform work that came out of the law team. But the law team and Lansing People's Assembly have been walking hand in hand for 4 years. So lots to unpack there as we move forward into this process. And again, with the economy, looking at labor, I mean, ultimately, we can measure the impact of policy on how it actually shows up in people's lives and who gets to build wealth, who is in the top seats in different institutions and organizations, who's actually making decisions about what the workforce is going to look like, what jobs will be in demand, or how our communities are shaped, what economic development looks like, what parts of town, what neighborhoods. All of those things are a part of this framework. We added voting rights and elections to the law. we knew, 7 years ago that policy, we are going to be challenged to make any substantial changes in policies if we're actually not also protecting voting rights and protecting elections. It was serious then. It was 2016, and we were just coming out of an election at the time TRHT was starting, and it is proven to be prophetic that needs to be a focus of the transformation. So that's the TRHT framework and how all of these pieces fit together to actually move our community towards racial equity. Next slide, please. So when TRHT started in 2016, well, it was December 2016, we launched TRHT in Lansing with the National Day of Racial Healing in 2017. And shortly thereafter, and I think Paul Elam actually co-facilitated this part with me when we set up the room with 5 stations from institutional racism and denial on one end of the continuum and racial equity on the other. Where as a community did we think we could move within 5 years? And we physically moved around the room with our bodies to the place that we thought that we could actually get to if we committed to the framework, if we committed to focusing on policies, if we used data to drive our analysis and decision-making. I think the community was honest, and most of the people gravitated towards 3. The community said, you know, if we actually commit to this, we think that we can get to inclusion. We think we can get to a place where we're being really intentional about who's at the table, whose voices are being heard. We're really paying attention to who's not in the room. And also realizing that inclusion doesn't actually change the results necessarily. People being in the room and having a voice doesn't necessarily produce a different result when you're talking about measurable incomes and measurable outcomes and impacts on people's lives. So we see, I think we're there, we're inclusive, look at us. But have the outcomes, are the results for children of color any different? Are our children any safer? Is our community any safer? We've still got some work to do. So I don't know that we will get to racial equity in a year, but can we actually just continue moving on the continuum? Can we get to a place of co-powerment? I got that from Donnie. So can we actually build the kind of power and co-create what we want and need together? Can we actually build power in community? Thank you, Jakayla, for being here. I'm so sorry because I do want to just continue to acknowledge how important it is to create space and opportunities. And I knew at 10:30 we wanted the media to be here, but young people typically can't be in our daytime meetings. And if we actually want youth voice, if we want youth power, we have to rethink. If we want parent voice and parent power, we have to rethink how we hold space in meetings. So this is specifically timed for media. And we did want to make sure that it's clear that we have work to do and we have to move differently in order for that to happen. So what does it look like for us to build power in community to support that kind of power? And that means, for some of us, it means sharing power. It means giving up power. Okay, next slide. So I spoke to data-driven transformation, and this is a lot of what we do. And I just want to thank Kat Westall, who's here with us today, who, along with Aislinn, who is now at Michigan Public Health Institute, created this Lansing Racial Equity Scorecard. I'm not going to click on the links because I want you to hear from people other than me. And I feel like I've been talking a lot already, and you're going to hear from me some more. but the Lansing Racial Equity Scorecard actually came out of my brother's keeper. Results-based accountability is a standard that we were held to. And now that we have recommitted, we are continuing to build out that racial equity scorecard. There are links in the slides, which everyone is going to get. Hopefully you registered, because we're going to send these slides out. The links are live, and we encourage everyone in the region to really use these resources. When we talk about the need for racial equity, it's not because our feelings are hurt and we feel bad. We need change because we cannot thrive or sustain as a region, as a state, as a country with the kind of inequity that exists and that continues to grow. It's unsustainable. So we want to ensure that we are using the best data to drive our decision making. And I really want to lift up at this time the HOPE data. We're not going to click into it, but again, a shout out to National Collaborative for Health Equity and to the Firecracker Foundation. We were in a 2-year community of practice examining the HOPE data and how, and the HOPE is Health Opportunity Index, and how the community safety data could help us set realistic goals that are asset-based, so that we're moving towards what we want to see. We started with community safety and looking at the number of deaths to gun violence in the first year. But what really stood out to us was, for Michigan, sexual assault was actually the worst indicator. In the entire state of Michigan, only 23% of people live in communities with low rates of sexual assault. That data is not in our county health rankings. When you look at measures of community safety, sexual assault often doesn't show up. There's a question of why, and even in the HOPE data, it was the worst indicator, and yet not the top line. So what we've asked is for that to be the top line, and for us as a community to really begin to dig deeper into what's underneath, why that data gets hidden. All right. Thank you, Tosh, for that. Next slide. All right, I'm going to kick it over to Kat to talk about the Lansing Racial Equity Scorecard. What are we looking at? What does it do? Why do we have it? And why do we need it? And anything else you want to share?
Great. Thanks, Angela. Hi, everyone. I'm Kat. As Angela mentioned, it's the work of Angela, Aislinn, myself, and others who really have just poured everything we can into this. It was originally launched, and this is Lansing specific, so it's the Lansing Racial Equity Scorecard. It was launched in May of 2021. And it was one of the goals named early in the TRHD process, like Angela had mentioned. The purpose of the scorecard is for it to take disaggregated data and make it widely available. So it's supposed to be available to community members, to leaders, to institutions, to be able to look at what racial equity result we want to get to. And so right here, you'll see on the screen, the result that we want to get to is all youth can learn and thrive in a safe and equitable community where their outcomes cannot be predicted by the color of their skin. That's where we want to be. And so a lot of the indicators which you'll see listed below, like graduation rates, youth homelessness, is centered around what community inequities we want to address in order to reach that result. And so some of these indicators are actually inspired by the My Brother's Keepers milestones that focus on the outcomes for boys and young men of color. And so the indicators here will help us reach what we want as a result of these inequities those bridges being gapped. And so again, this is for community members to be able to have access to this, to be able to move forward the community equity priorities to track a progress toward a Lansing which Black children and families can experience justice, opportunity, and abundance. So I would really encourage you to use this tool in starting up community conversations, to holding institutions and leaders accountable in order for us to move forward with transformative change. So I will pass it back over to Angela.
Thank you, Kat. And I'm sorry, I'm way over time. And so we're going to share these slides out, and I want to give space for other people to talk right now. And then time permitting, we'll come back to this. But just know that Lansing People's Assembly has been working on community safety priorities. And as you can quickly see on the slide, more police was not on the list. In the conversations we've had in 4 years, in terms of what community safety looks like, examining what's happening with the prosecutors and with students and parents and teachers, we've been having multiple conversations with multiple groups, and it's getting to the root causes. I'll just say that and keep moving real quick. Okay, we're going to come back to the Ingham Breathe Act, but this slide is intended to show you that we're starting with repair. We actually have to understand the history of how we got here, understand the data, acknowledge that we as a community actually have work to do to heal, that we as individuals have healing to do, that we as a region need to heal together. All right, next slide. All right. This is what I wanted to get to. For you to hear from somebody other than me. You'll hear from me again later, so don't be too sad. But please, Health Department, Dr. Shoyinka, take it away.
Good morning again, and thank you, Angela, for giving us a lot of context, for sharing, giving us a timeline, for just sharing that history of where we've been as a community. I do want to take a minute, first of all, to say thank you to you, Angela, and to One Love Global for creating this space for us to have this critical conversation. It's really important to acknowledge where we've been, as you have kind of taken us down history, memory lane, taking us through history, particularly for this region, where we've been, where we are today, and where we need to go, what we need to do as we address racism as a public health issue, an issue that is urgent. I want to thank you for the continued work that you've done in this space as we talked about the history and where things have been since 2008 and how that work has been there. It is clear that you and One Love Global and many partners here in the room have worked tirelessly, continuing to find the solutions, find the answers to make sure that our communities live healthier, better lives. And I also want to thank you for the particular attention that you're paying to the next generation. We talk about how, we're making all these efforts and we don't really know. You talked about if we will ever get to racial equity, being able to assure that our systems are evaluated properly and make sure that their outcomes are not just dependent on the color of people's skin, but on what is available to them and making sure that everybody has what's available. So I just want to thank you for all the work that you're doing and for the opportunity to be here. And thank you for including Ingham County in these conversations. I also want to thank the community in general, because most of the work that we do is really should be, and we're more and more realizing, more and more engaging in that space, acknowledging that we need to listen and engage our communities and engage our partners, engage our community agencies to ensure that we know what is needed in order to drive our work. And so thank you to everyone here. And so as we talk about the topic today, what we're talking about here is what racism is how it impacts us. And when we talk about systemic racism, we see it everywhere. It's in every fabric of our society. It shows up everywhere in all the work that we do, in all our outcomes, in the places where we work, live, and play. It shows up in health disparities, talk about chronic diseases, talk about maternal and child health or morbidity and mortality. If we remember what happened with COVID-19, we could see those disparities, those differences between what the numbers looked like for people of color versus people who were not people of color. It shows up in the inequities, the imbalances that we see in the resources that are available to us in our communities, in our educational systems, in our neighborhoods, where we get access to care, how we show up, how we are able to, when I think about access to care, how do I connect with my healthcare provider? How do I follow the recommendations? Do I have access to the medication? Am I able to follow the instructions based on where I live or what I have or the food I have access to? What do our communities look like in terms of built environment, in terms of what are we exposed to because of where we live? Are we exposed to substances that over time cause us harm, and so many other factors? So when you think about all of those things, we at the health department in the public health space, we talk about all of that and call it social determinants of health. And if you want to define social determinants of health, which I'm sure many of you are familiar with that term, but just thinking about it from our own context, we think about it in the context of those non-medical factors that influence health outcomes. And as Angela has shared, based on a lot of the data we see, those factors and those conditions are what we see and what happens in the context of where we're born, where we grow, where we live, where we work, where we play, how we age, and what does the systems that we live in, how do the systems that we interact with, how do they shape the conditions of our daily lives? And those conditions, like I've mentioned, income, as you can see on the slide, our income, our jobs, our employment, where we work, childhood development, where are our children developing? What are they being exposed to? How much are we able to eat? How food secure are we at? Like I mentioned before, healthcare services, gender, race, disability, all of those things impact our health as a society. And we continue to see that systemic racism impacts all of those things differently for people of color. Our mission at the health department, our mandate, what we're charged to do at the health department is to protect, improve, and advocate for the health and well-being of our community. And we do this by identifying and advancing conditions under which all people can achieve optimum health. And we recognize that if we cannot do this without addressing social determinants of health. And more we're working to incorporate that more into the work that we do, acknowledging that all of this work is not simple. None of it is linear. As we talk about the work that we do in the community, the work that One Love Global does as we engage with our community partners, we acknowledge the fact, just like Angela, you had mentioned earlier, that none of this is simple. We have a lot of legacy changes, systems change, people change. And so sometimes the work that seems like it should be 10 steps forward, we do 2 steps forward and then, a few even more backwards. And so sometimes it's not as straightforward as just putting things into place, but we continue to do that work to grapple, to make sure that we can keep this as our focus. So like I said, we recognize that social determinants of health, as I've described to you, is important. It's key in the equity work that we do at the health department. And we do this in a variety of ways. One major thing that I want to lift up is that we, more than ever before, even though we've done this for a long time, over time, we continue to recognize that community input is super important to the work that we do. Right now, we're working on some initiatives that are born out of our community needs assessment and that have been outlined in our community health improvement plan. And these are to promote primarily safe and affordable housing and to advance community safety. Over the years, we have had our community health needs assessment, community needs assessment, and these last two items have been included in our last iteration of our community needs assessment, where the other priorities identified were improving and continuing to advance access to care, to healthcare in particular, and also improving behavioral health in general. But with regards to the two items that I just mentioned, some of that work includes that we've started within the health department right now, includes hiring a community healthcare worker who helps our community members with navigating and identifying ways to ensure that within our community, we have that safe and affordable housing. We, as an organization, are conducting focus groups to make sure that we can look for ways to ensure that we continue to include all of our voices in our municipal planning efforts. So we continue to participate in that and making sure that there's good participation and leadership in our regional housing plan. When we think about violence, Angela talked a lot about data, and we recognize that in the context of community safety, just as Angela highlighted, data is super important to direct the work that we do. And just as has been mentioned, as we continue to peruse the data, dive deeply into it, we recognize we continue to look for where those gaps are, one of which Angela mentioned when we talk about sexual violence in general. So working to analyze and better understand the data around violence is something that we are doing more of. And then, of course, we're working closely to address gang-related and retaliatory gun violence within our communities. And Angela mentioned Dr. Paul Elam's name and MPHI multiple times, as I'm sure many of you are familiar or have heard of the work and activity that the health department and MPHI do in the space of retaliatory gun violence with the Advanced Peace Program, which is working to reduce gun violence in our communities and continues to look at ways to do work better. Even just recently, we still had a conversation acknowledging the recent violence that happened last weekend over Memorial Day weekend, sadly resulting in another youth's life, and looking at where could we have done better in this space? What did we miss? What kind of information did we need? What do we need to do in the future, acknowledging that in this time of the year too, things happen differently. And sometimes that data directs us as to when and where to direct our activities. These are some of the examples. I could talk about some of the work that happens in the health department in general. Like I mentioned, access to care. Our programs, our public health programs are integrated with our health care, our direct healthcare programs in order to improve outcomes within our communities, and many things are done to advance this work. All of these are important. All of these impact social determinants of health. All of them address some of these issues that I mentioned, but they can be seen somewhat as surface. I'm a physician, and sometimes using the analogy of what healthcare looks like can help. It's almost like we're talking about symptoms versus what exactly is causing the problem. And so acknowledging that here, in the context of what we're talking about here, while we can address food insecurity and, talk about what needs to be done in the housing space, as I had mentioned, getting someone to help with identifying with, helping with navigation and doing things within our school system, we acknowledge that there's a root cause to all of the things that we're seeing, and that is the systemic racism. That is the structural oppression that we have within our systems. And it's super important that we address that. If you look at this slide from Human Impact Partners, it illustrates that, the imbalances in power, how that can promote inequities, how it can foster structural oppression, and how it's important for us to address those root causes like racism in order to ensure the health of our communities. Can you show the next slide, please? Just another slide to, again, demonstrate what we're talking about here and how this is important in the work that we do. If you look at that bottom line, the underlying systems of dominant culture and narratives are seen in the soil. It's the system, it's something that has to be either changed, or we have to change the components of the soil in order for us to be able to get to impact the root causes of health, which show up in sexism, classism, racism, poverty, all of those things. But acknowledging that what happens in our system is a direct factor that impacts all of that. Hence, what shows up in the social determinants of health, hence what shows up subsequently in the health behaviors and in the health outcomes of the people within our communities, particularly as we talk about Black and Brown people. We continue to do this work, like I said, acknowledging that to dismantle, to change the soil, the component of the soil, it requires oversight, it requires transparency, more transparency, requires accountability, vigilance, commitment, and the willingness for us to acknowledge and address some of the worst parts of our history, some of the worst parts of the systems that we belong to, where we operate, and work together with our communities, hearing what our communities have to say in order to address them and make the necessary changes so that one day we can get to a place of racial equity, potentially in our lifetime. Ingham County Health Department works with our community partners. We, over the last year, have been working with One Love Global in the Truth, Racial Healing and Transformation Initiative, and more recently, as part of a cohort with Human Impact Partners to create for power building partnerships for health. And these activities are the things that we are doing in collaboration with our communities to work towards having a better understanding of what we should be doing, how we should be doing things in order to address systemic racism in particular, while we continue to address the issues that we face, the outcomes that are as a result of that. There's no reason why people of color in general should have worse healthcare outcomes than people who are not people of color. And we see that show up everywhere in, like I mentioned before, maternal mortality, infant mortality, COVID-19, substance use disorders, cancer outcomes, education, all of it all of those things show up in ways that should not be. And that has nothing to do with race in particular. We acknowledge that everyone deserves a chance to live long and a healthy life, and we're committed to do that work. And that's why we're happy to be here, to be part of this conversation, to be part of one, acknowledging and celebrating all of our community partners who in 2020 stood up to acknowledge racism as a public health issue, a public health emergency even. And so many of our community partners, municipalities stood up to do that, while at the same time acknowledging some of the work that has been done, but knowing that there's so much more that needs to be done. And so here we, as Ingham County Health Department, are here to stand in this space with you, to commit to this work as we have in the past, but also to recommit to being in that space of vigilance, of oversight, of accountability, of being transparent, of being willing to have the hard conversations for the sole reason that we have a mandate to ensure better outcomes for the communities that we serve. I just want to highlight a couple of things that has happened, that we've done within the health department, and county space to address systemic racism as a public health issue. So first of all, one of the things that did earlier last year was to include a health equity statement to on our Ingham County Health Department webpage. That statement recognizes the impact of oppression and how it has the impacts that oppression has on health factors and outcomes based on the data that we see. We've talked about how critical data is, and you can see that statement. It essentially says that Ingham County Health Department acknowledges that health is impacted by many factors, and one set of factors contributing to disparities is the way society, people, and institutions have been designed to preserve historical power through systems such as racism, sexism, ableism, heterosexism, and other forms of oppression. And like I said, you can find that on our Ingham County Health Department page. We also, thank you, Dana. We also, we're in our year 2 of coordinating of our Health Equity Council. Our Health Equity Council, we are very proud of, is a body of BIPOC community members who share a perspective and lived experience and help guide the department's initiatives. One of the major programs that this includes is a mini grant program where the council awards annually about $150,000 to address health inequities in our BIPOC communities. We engage community partners within the community who are doing the work, and we have them, we support them through these grants in order for them to be able to do the work. We want to note, though, that our council members are also paid for their time and for their expertise, acknowledging that this is also a really important piece of that equity work that we talked about. As we listen for more input from our communities, acknowledging the time and effort that takes is also important. Going back to the conversation about data, our Racial Equity Data Initiative, this program was also led by the Health Equity Council, and this group had helped us to change the way we ask our people, our community, about race, ethnicity, and gender in our surveys to make sure that they better align with the way people identify. I'm sure some of you have filled out forms where it's like, okay, you know, it says race and ethnicity, but I don't necessarily see where I 100% align. And we are trying to do a better job to make sure that people can check more than just one race or one ethnicity now, depending on how they identify. We recently, Dana Watson has helped us, our Health Equity and Social Justice Coordinator has worked to develop a new implicit bias training that was launched last year for all our Ingham County staff, clinical and public health staff. We recently piloted and updated our version of our health equity and social justice workshop. I will say that Ingham County does have a long history of working to educate and expose our staff about what health equity and social justice looks like. But we recognize that there's more work to be done, and that in the space that we're in now, it was really critical that that workshop was updated to reflect all that we stand for today. As mentioned previously, the Truth Racial Healing and Transformation Initiative, and of course the cohort that we're part of with Human Impact Partners, with their program, the cohort Power Building Partnerships for Health, is something that we are working on right now as a one-year program with One Love Global to make sure that we continue to do the work as is appropriate, and making sure that we get the right feedback. This group, this organization uses a strategy called the inside outside strategy, where they engage both community agencies and public agencies, such as governmental agencies, ensuring that we're able to work together to do the work and advance the work through, our policies, and all the activities that we do. And then, as I mentioned, well, talking about policies, Ingham County also implemented a health and all policies approach to improving the health of all our people by incorporating health considerations into our decision-making process. And there are 5 key elements of that. One is promoting health equity and sustainability, supporting intersectional collaboration, benefiting multiple partners, some of which I've already touched on before, engaging stakeholders at every level, at every step of what we do, and creating structural or process change through project prioritization that produces benefit to the communities who are disproportionately impacted or who have been historically disproportionately impacted by social inequity, climate, and environmental injustices. There is so much work yet to be done. These are some of the few things that we have been doing at the health department. And as I mentioned before, we are here in collaboration with everyone else here to recommit to continue to do that work. So thank you very much again to One Love Global. Thank you very much to everyone in our community for being here and being a part of this conversation. And we look forward to continuing to do that work with all of you, hearing from you and using all the inputs that you have to ensure the work and to do the mandate that we've been called to do at the health department. Thank you.
Thank you so much, Dr. Shoyinka. I'm going to turn it right over to Ryan to tell us about the power of story and dialogue and policy transformation.
Thanks, Angela, and thank you, Dr. Shoyinka. For those joining late, my name is Ryan Rowe. My pronouns are he, him, and I'm the Institutional Equity and Community Partnerships Manager for MPHI, also known as the Michigan Public Health Institute. Our CEO, Dr. Renee Branch Kennedy, asked me to speak on her behalf and on behalf of MPHI today. I think I know why. And we were asked, as you see here, to share a little bit about our journey related to racism as a public health crisis and the power of relationship shifting dialogue and story-based organizing in that effort. So really thank you for having us. First, on behalf of MPHI, I want to say that we're honored to be a part of this partnership as members of the Ingham Healing Through Policy Initiative, and are pleased to renew our commitment to this racial equity accountability process. In my role half of my work, and I should say that I hear Dr. Elam's name come up a lot. I also work closely with our Chief Strategy Officer here in a big portion of my work, and that portion is leading our efforts to become an anti-oppressive public health institute. And the other half is to work with community coalitions like this one and clients who are also trying to transform their organizations from within to be the best partners in the work of racial equity and social justice that they can be. Next slide. Briefly, just to place myself as my mentors have always encouraged me to do, and start with my own story. Justice is the core of my faith identity and relational story-based community organizing for racial, economic, and LGBTQ plus justice with organizations and coalitions like the Human Rights Campaign, the National NAACP, the Poor People's Campaign, and now MPHI has been my life's work. So you see in that top there, that guy in the middle is actually the guy you should call if I cut up here. That's my dad, the Reverend Edwin Rowe, and that's me and some folks from the Poor People's Campaign on the steps of the Lansing State Capitol. That second shot is me working with the Maryland NAACP around marriage equality initiative in 2012. And that's me and my colleague Hope Jackson at the bottom doing some of our voter action academy work with the Human Rights Campaign. And there again on the right is me outside the Capitol with our Poor People's Campaign efforts. Next slide. I also happen to serve as the Health Equity and Social Justice Coordinator for the Ingham County Health Department in 2020. Yes, I am the old Dana Watson. And I helped lead Ingham County's COVID-19 task force on racial and ethnic disparities that included Dr. Kennedy, Dr. Shoyinka, Commissioner Darrell Slaughter, and many of you here as we help to shape and move Ingham's declaration of racism as a public health crisis. Say all that to say that I think I know why Dr. Kennedy asked me to speak, and I am personally moved and pleased to see this work continued, refined, and deepened, and grateful for this opportunity to be back with you. While the advocacy for centering equity in public health and to go beneath the social determinants of health to name the root causes of oppression, as you saw in Dr. Shoyinka's illustration, racism, sexism, classism, and their many cousins like heterosexism, transmisogyny, and ableism, has been the work of leaders like Dr. Kennedy and many others for many years. And PHI's role in this partnership was born out of that COVID-19 task force and Ingham's declaration of racism as a public health crisis. It has continued in important coalitions like this one with community members and organizations like One Love Global, the Firecracker Foundation, Ingham County Health Department, and LEAP, to ensure that we don't stop at resolutions, task forces, or hiring DEI directors, but tangibly begin to eliminate and continue to eliminate the damaging effects of racism in the community. Next slide. As Dr. Kennedy has said, racism is a threat to public health. It damages the relationships needed to advance well-being and contributes to policies that disproportionately harm people of color and under-resourced communities, as Angela and Dr. Shoyinka have already really dug into in terms of what that looks like locally. Our story at MPHI in this and any effort to make lasting change is always centered around that operative word, relationship, and the dialogue and story sharing that moves us out of isolation from tragedies like the pandemic to heal and reform community, move beyond entrenched strategies, and find common ground for meeting the needs of those most impacted in our community. If the problem, or one of the problems we're trying to solve, is to ensure that all of our declarations, value statements, task forces, and action plans for addressing racism in our region don't die on the vine of good intentions, then science, experience, and best practice teach us that we need to move ourselves and each other from our heads to our hearts and ensure that our institutions with the most power to affect change grow into having the humility and capacity to center and respond to those most impacted by racism. Next slide. So the work of Dr. Kennedy, other public health leaders like Dr. Gail Christopher, and a group that I work with closely, called the Movement Advancement Project, tell us that whether it's getting employees to buy into institutional transformation or moving community members and institutions to create and support transformational policy change, what changes behavior and moves people to action is not just facts and figures, all that's very important for knowing the problem and evaluating the efforts that we're doing, debates or polite conversations, but deepening relationships and putting faces, names, and stories to the problems we're trying to confront. One of the common stories in my work, as I was one of the national field directors for the Human Rights Campaign for 8 years, was that we originally, in our fight for marriage equality, lost 32 different ballot initiatives to pass at the state level, pass marriage equality. And the big shift in that movement was moving from civil rights frameworks to love and commitment. And that allowed folks to have a heart-centered, humanizing stories that connected folks to see in each other's stories people that reminded them of their daughters and their fathers and their neighbors. And so that was when we started to win. And it's sad that civil rights frameworks didn't work in that effort, but it did make sense, and as we studied it, that people needed to see themselves and needed to move from issues and facts and debates to that human connection that allowed us to move people to action. So for me personally, as I introduced you to my father, who's the pastor emeritus at Central United Methodist Church in Detroit, one story that personally affects me in that movement was that he would have gladly been defrocked and lost his pension to do my sister's wedding, because that's what would have happened under the law of the United Methodist Church. But my sister and her wife, who both worked at MPHI at one point, decided that they didn't want to politicize their wedding, and that didn't happen for my dad and my sister. I don't know if you've seen in the news, but the United Methodist Church has since split and has grown around those policies. But at the time, it was not even legal to have that ceremony. But I ended up facilitating, and it is a bittersweet memory, of course. But that is my personal story that drives my why and has driven my why in those movements. And I've told it many times to legislators and voters on stages to illustrate how it impacted me personally. So say all that to say that we've learned over and over that finding ways for legislators, voters to move from thinking about abstract issues and data to the feeling of connection to the real lives of our neighbors and coworkers, moves them to action, passes legislation, gets champions elected, and impacts lasting systemic change. So to be clear, practicing and embracing the power of story and dialogue in racial justice and policy change is not advocating for more conversations or debates about racism or anything that is a crisis in health in our community. But whether it's the Breathe Act or other anti-racist policies or institutional racial equity transformation initiatives, we're hoping to always do the work to listen deeper and shift voice and power back to those most impacted by racism. Being led by these voices in the service of the work then transforms the fundamental ways our institutions function, think, and act to lead the institutional change we need and be more effective partners in shaping new community-driven policy and ensuring that existing policy resources are enacted and lead to lasting change. Next slide. So if you've ever been in our Just workshop that Dr. Kennedy helped create, and I used to co-facilitate at the Ingham County Health Department, you may recognize some variation of this slide, but when we talk about dialogue, it's important, again, to clarify what it is and isn't. Dialogue is power shifting to those most impacted. Dialogue is not just conversation within the same system without changing that system. Dialogue is focused on the collective and finding common purpose. It's not debate or closed to those that you trust and know. dialogue asks to give up strategies to meet everyone's needs. It asks us to never give up what we truly need, but once we establish that, to create new strategies where everyone's needs get met, as opposed to what dialogue isn't, which are not to say that we, again, don't need studies, workshops, declarations, and speeches, and events like this, but that's not dialogue. And lastly, dialogue is open. It requires humility, self-reflection, and a willingness to change your perspective. What dialogue isn't is a controlled environment where we sometimes, for example, have been known, and I think we're all guilty of this in different ways, of building a process and then inviting the community to it. So I want to be clear about what I mean by dialogue, because I understand and have heard many times that what folks don't need are more conversations. And I would agree with that if we're talking about dialogue versus conversation. Next slide. Actually, if you could stay on that slide, my apologies. Can we go back? One last point, just to bring it home, is that lasting change of racial equity hinges on bringing together and respecting the critical wisdom and power of both those most impacted by the problem and those with the privilege of having the power, position, and resources to meet their needs. Too often, these are two different groups of people. In academic language, sometimes we call it cultural responsiveness. Grassroots community organizers have been calling it nothing about us for a lot longer. Next slide. So at MPHI, as you know, I've been leading our internal work to hold ourselves accountable to our values. Since that 2020 moment and opportunity, and since joining the declarations and current partnerships for addressing racism as a public health crisis, our story has led us inward and outward. Inwardly, we have articulated to go beyond our stated values of health equity and social justice, to create our first anti-oppression leadership team, our new Office of Anti-Oppression Strategies and Internal Solutions. We've created a staff of color affinity group, a white accountability group, and we have a staff wellness initiative within the context of healing what was happening to our BIPOC staff, but all of our staff trying to respond in the middle of isolation, polarization, threats to our mental health, and COVID during that moment. So it's certainly healing from within to be better partners in the healing with our community. Next slide. Externally, we partner with many local municipalities and organizations to shift ways our powerful institutions are listening to what BIPOC community members have already been saying and asking for related to systemic racism, and have tried to help make the link between those voices and what needs to be transformed in our systems, cultures, and processes as a result. In addition to our work in dialogue with this Healing Through Policy partnership, we've served as a bridge for municipalities and organizations with regional BIPOC-led organizations as well to facilitate dialogues, collect and analyze community-centered recommendations for addressing specific aspects of systemic racism. For example, workforce development, and to also look at how current gaps in communication, service provision, cultural responsiveness, and capacity can be addressed in the systems and cultural norms of organizations. All of this assists in framing some of these policies, capacity building, and organizational change initiatives. Of course, we are honored to work with our partners like One Love Global and the Firecracker Foundation, who, as you've seen, have a very long and deep history of being trusted to lead in this work, and we're honored to contribute to this, the types of dialogue and healing spaces that they've shown in places like TRHD and the People's Assembly. Next slide. So in summary, what we tried to embody and what we've learned in our journey over this last 4 years can be summarized in these three components: respond, shift power, and move head to heart. And I know that you'll see lots of overlaps in what the other speakers here are saying today. I think this comes in part out of this coalition as well. But when we say respond, we mean to be responsive to those who are most impacted and be open and looking for ways that leads us to transform our own organizations and initiatives to be more accountable to those most impacted. And then have the types of dialogues that don't perpetuate the same system, but shift power to those most impacted and center BIPOC community voices. And then this tried and true best practice that, while again, we need good data to know where it hurts, and we need good data to know whether we've actually done what we said we were going to do. We actually need community-centered evaluation processes that don't just apply a metric, but actually center the community in saying, did this actually improve your life and help you be less impacted by racism? But all of that is to mobilize our institutions to actually change policy, change systems, and see those tangible results. So that's sort of what I think we were asked to share today. I hope that was helpful. It certainly connects a lot to what was said, but in closing, I'll just say it's clear that the work of truth, racial healing, transformation, and culturally responsive dialogue to change policy and tangibly eliminate the root causes and effects of systemic racism in our community is not an easy shift. As you've heard, our Ingham Healing Through Policy Coalition members have leaned into this deeper power naming, power shifting, culturally responsive dialogue as we needed to name our differences to move to common ground and focus in this work so that we could be more effective. And PHI is here and committed to partnering and embracing this process of healing trust, deepening relationship, and centering the lived experience of those most impacted by racism in our region as we continue in this important work of racial equity and accountability. As Dr. Kennedy would probably say, we are honored to be at this table with you.
Thank you, Ryan. Thank you, Dr. Shoyinka. Again, your in-depth presentations are greatly appreciated. And again, we are recording and look forward to sharing this so that people can actually go deeper. They can replay, they can go back and view the slides. Ryan, I want to just open this up because you mentioned two things that are really important. One is nothing for us without us. And also purpose, like our why. Why do we show up here? And I mentioned Peace and Prosperity Youth Action Movement starting 15 years ago. And I'm going to give space to the why right now because we've actually talked about how we heal in the TRHT framework, and it's clear that we need coalition for things to happen. But what drives us? What's the story behind the data? I asked Jakayla Hobbs to share with us why youth voice and youth power is so important, because it's what drives me. When we set priorities at One Love Global, it is because of the youth. I used to be with them every Saturday from 9 a.m. till 1 p.m. And that is how we got here based on their priorities. And Jakayla, I'm just going to turn it over to you to share why youth voice is important, why building youth power is important, and how we can do a better job at it. And this is like an analysis of our work at One Love Global and PPM, like keep it real. What do we need to do better? Are you able to unmute, love? I'm trying to get you there.
Sorry, I thought I was unmuted. Thank you. So, as Angela said, my name is Jakayla Hobbs, and I've been a part of PPM for about 6 years, and we've done a lot. So, I know as youth, we are kind of always told that we are the future, and I believe that acknowledging and amplifying our voices can definitely broaden perspectives as a whole. And it also gives us as youth the opportunity to make a positive impact on and affect change in our community, now as youth and continually as adults. One specific example that is more recent, as Dr. Shoyinka was saying earlier, there was a group of youth affected by gun violence earlier this week, which weighed heavily on a lot of our hearts. So last Friday, we had a healing circle at our Peace and Prosperity Youth Action Movement meeting. And I believe that that healing circle really made us all feel heard. We were able to voice our opinions on what happened, brainstorm ideas on how to eradicate gun violence, and brainstorm ideas on how to make change in our community. And I believe that the healing circle really made each of us feel heard and made us feel like we can really make change in our community. And I believe that holding spaces for youth to share their voices, like healing circles or other things, like youth panels or other things, will continue to make you feel like they're heard. And also giving us the support and backing we need to take action will encourage youth involvement in our communities in the future. And yeah.
Yeah, that's right. Thank you, Jakila. Yes. Yes, yes, yes. Yes to youth healing circles. Yes to youth leadership. And 6 years, and congratulations, graduate, and soon to be joining the Wolverine team. Yes. Sorry, Spartans. This is Wolverine country. All right. Next slide, please. So why are we here? We're here to invite our region into a racial equity accountability process. Where do people go to actually get to the root causes? How do we begin to have the kind of dialogues that lead to action, that lead to transformative policy? This is an invitation to join this first cohort in a co-created process, because as Ryan says, you don't build it first and then try to sell it. We're going to build this together. I want to shout out Tajmika again, because we got together over a year, like during COVID, and like it tried to envision what a racial equity accountability process that had at its core healing. What does justice that heals look like? How do we get to policies that actually create healing and care that actually look like love? And as Ryan said, that a commitment and love, that is accountability. We're accountable to people that we love. We love our community and we want to be accountable. We want to see different results. It's not enough to just do. Are the things we're doing having the measured intent? Are we actually changing the material conditions of people's lives and getting to the root causes? So this is going to take some relationship building. It's going to take some narrative power. We invited the media, and honestly, I'm like looking at the participants. I don't know if we actually have media here, but that's why we actually have our own media platforms, because we know how this works. We know how our issues, our priorities, how the voices of the most directly impact the most marginalized people rarely make it to the headlines. That's why we create our own headlines. That's why we create these spaces. So it's up to us to decide where we want to be 4 years from now. The more we understand how we got here in 2024, the better we're able to navigate how we get to 2028 and where we want to be then. Next slide, please. Next slide. I'm just going to keep it moving here. Actually go back for me, please. Because I do want to point out something that's happening. Again, community voice. A lot is happening about MLK and community development. And I'm going to turn it over to Tony here in just a minute to talk about what equitable economic development looks like. And an opportunity for you to actually hear some more about that is this week on Thursday at 6 p.m. at One Love Global, which is on MLK at Homes in that little strip mall. And it's got pictures of our youth right on the window, so you can't miss it. So please come out for that conversation, because we want the community to determine what South Lansing looks like. So this is a chance for us to vision together. Thanks to Ingham County Commissioner Miles Johnson. Thank you for creating the space for that to happen. Next slide, please. So again, the My Brother's Keeper milestones. Sorry about that typo there. You saw that we have a Lansing Racial Equity Scorecard that is tracking some of this data. And the more we actually focus on the results that we want to achieve, We want to make sure youth are ready. We want them reading. How do we actually move towards that through policy as well as practice? Next slide, please. We're looking for generational change. Jakayla just said she's been in PPM for 6 years. I just saw one of our PPM members celebrate their birthday. They're turning 29. It's hard for me to imagine that the first PPM members are now 29-year-olds. They've graduated, they're having families, they're all over the world. It's just amazing. And I just want to point out, because we think of life as linear, and it is a cycle. And we talk a lot about breaking cycles and creating better cycles. How do we actually intervene no matter what stage of life we're in ways that actually are healing and produce better results? And so with My Brother's Keeper, it's less about programs and more about the population. Are we actually achieving population level change? Population level change requires systemic change and policy change. And so that is why we focus on policy. Next slide. All right. And to you, Tony Willis, thank you so much for your patience. I hope you've listened deeply and can infuse some of that in your vision for us for economic justice.
Absolutely, Angela. And I appreciate you. I appreciate everybody for allowing me to share some of this time here, because it all goes together, from racism as a health pandemic, and racism breeds and goes and flows into all different aspects of institutions, including economics and economic development. So next slide, please. So when we talk about economic justice, this is what one definition of economic justice is. And we just break down the two root words for economic and justice. So economics is a social science. It is the how we decide and make decisions on the effects of our labor, our productivity, of our resources. That's what economics is all about. And then justice, by the root word, it means fair or reasonable. So put those together. How do we fairly and reasonably make good decisions on our resources, our labor, our capital, our resources, our people, all the above, and making sure that it's just for everyone. And so, and this isn't something radical. This isn't something crazy. This isn't, this is pretty much in the foundational level of what economics is. And I kind of jumped ahead here. So once again, my name is Tony Willis. I'm the Chief Equity Development Officer for the Lansing Economic Area Partnership. I've been doing economic development for the last 10 years, mostly for focus on small business support, as well as innovation. And in the last 4 years, spearheading our equitable department called DEEP, Department of Equitable Economic Planning, and working very closely with Angela of One Love Global, as many other partners in the community, to make sure that people have access to the benefits of economic development. And so that kind of ties into what economic justice means, and it flows in with equitable development. Also with me, I'm a little bit of a kind of historian and nerd in this aspect of it, because root words, root causes, and from Donnie starting us off, talking about how we've ended up in this state of affairs, all the way to Dr. Sholinka and her overview of the current crises. There are roots, and all those things share and bear symptoms later on. And so with this presentation, you'll see a little bit of that as well. Next slide, please. And so this slide is kind of setting the stage here. Economics as a theory and a train of thought is attributed to this individual, Adam Smith. So around 1760, this individual wrote a book or paper at that time called The Wealth of Nations, which predates capitalism, predates communism, predates socialism, Keynesian economics and before. And within that, he makes, it's a long book. It's over, 860 odd pages, but he makes some pretty stark declarations. And one being this highlighted part here: no society can surely be flourishing and happy of which the far greater part of its members are poor and miserable. And understanding that as we build out systems, to get wealth and to create items and create things for human prosperity, we have to understand that we must be tolerably, which is a reasonable amount of all of our folks can be well-fed, clothed, and lodged at a tolerable expense, which is nothing to, intolerably means that doesn't require more expense to the individuals doing that if it's not them themselves. And I use this as a backdrop because we see our society now, there's times where people feel that things are leaning in disproportionality, that things aren't getting better, especially for certain groups of folks. And if we go to the next slides, you'll see more details about what this looks like. So we use ALICE, a report from the Michigan United Way, which is a report highlighting the asset limited income constrained employed households within our community. And so since 2020, United Way has done this for each state, and Michigan being one of those. And the number has increased when it comes to how many households are at or below the ALICE threshold. And so when this report first came out in 2020, so before the pandemic, we had around 38% of households in Michigan were labeled at or below the ALICE threshold. And ALICE means that you are employed, you have income, but you're not making enough money to pay all of your bills, necessities to make ends meet. So we have 13% of Michigander or households are in poverty, and another 28% are in the ALICE threshold. And so it's a totality, those two numbers together, we have 41% of folks, households in Michigan, where they're economically unstable. And so to that previous quote I mentioned from Adam Smith, society can't work economically if a far greater portion of people are miserable or in poor condition. And we see this actually increasing here. Economically unstable, what that means is that you're in a less stable and less optimistic stance of the future. And moving forward, for the next slide here, we have some more details what that means to individual demographics. So from the last report we have here are broken between race and ethnicity, as well as rural and urban, and kind of showing you an overview of how this isn't just limited to one demographic or another. And so we have the race and ethnicity to your left, we have the number of households in the middle, and the percentage of folks within the ALICE threshold to your right. And so going down this line here, you will see that if we go to Black line 3 here, for Black people itself, we have just over 60% of Black households are at or below the ALICE threshold for Michigan. So 60% of Black households in Michigan are economically unstable. When you look at Hispanic households, around 47% of folks are economically unstable within that. And there's more stats I'm gonna bring up to here as well regarding looking at single woman-led households. 74% of single woman-led households, so if you're a single woman with kids, 74% of those households are at or below the ALICE threshold. And then we look at the rural versus urban divide, if there is such one. You understand here, it's not a rural or urban issue. It's pretty much cut between that. This goes across both territories when folks are being economically unstable. And again, as a backdrop, economic justice is how we look at the fair and reasonable use of our resources and decision-making for those resources, that everybody has a fair and reasonable outcome and output involved, which has not been the case historically. There's been plenty of exploitative issues and policies from slavery, from Jim Crow, from other policies, from access and denial of access to capital, and many other forms of harm that have been done to Black and brown people and other demographics throughout as well. Next slide, please. So that is a backdrop. And LEAP is the economic development organization for the region, and really focusing on a prosperous economy where everybody can flourish. So in 2021, we created my department, Department of Equitable Economic Planning. And then later on in 2022, the IEDC, the International Economic Development Council, released its thoughts on equitable development and how pretty much a flow chart of what needs to take place, which aligned with we already had started. One was to make sure we acknowledge the history and discrimination and that is taking place for the people in the community, in your community, understanding that things have happened. Those transgressions may still exist. Healing takes time, and we have to acknowledge somebody's hurt to go forward. Then is to actually create targeted programs to help close those gaps, to help bridge and create access to resources. Then further is always collaboration is key, because this isn't a task that one individual or one group can, take on by themselves. And then there's a quote, if it's important, you measure it. We all measure our income. You measure how much food you have. You measure your health. If it's important, you measure it, and understanding what does that look like. And we implement a lot of these things within our Department of Equitable Economic Planning at LEAP, and looking into furthering these. And with that, I'll talk to you about a few of our programs that kind of take this initial flow here. So we'll go into the next slide. So I mentioned about Alice, and one is acknowledging the history of how we've got here. And so at LEAP, we've made a commitment to be very transparent, as well as being very progressive when it comes to making sure we have an economy that's inclusive and welcoming for all. Because I always stated this, and Bob would agree, is that the communities of the future that be the most prosperous are the ones that are, one, the most educated, and two, the most welcoming. You think of what the communities of the future will be, because the communities of the future have to be welcoming, because talent resides in every demographic. Black, white, gender, sexuality, religion. Talent is not monolithic and not exclusive to one demographic. So the communities of the future will be most welcoming to the most folks as possible. And then education is also a crucial component here, because data shows the more educated the community is, the higher level of prosperity those communities have. So those are two key factors we look at into the future. And so at LEAP, we're creating programs and initiatives around those, as well as understanding our current level of need in the community. We talked about Alice, and with that, in 2020, we launched a program called One and All, which I'll get into. And actually, I'll stop here. All these are programs that we've done to date that are focused on our equitable development theme. And then we have about 3 or 4 other ones in the queue that we're looking to deploy within the next year or two as well, because it takes many different tools and tasks to create a more just and equitable economy for all. So with that, next slide, please. So this is One and All. This is a program that we designed to make sure that folks that are at or below the ALICE threshold have the ability to participate in their dreams of entrepreneurship. Because in a capitalist society, entrepreneurship and ownership is a major driver for wealth generation. Ownership, whether it's stocks, land, a business itself, outright, enhances your position of capital and wealth growth in a capitalist society. And we know this, that if you are working, all these folks are working but not making enough money because of probably a myriad of factors. Some are in their control, some not, and industry controls not. But we want to make sure that people have access to start a business and help grow that wealth position with that. So we started this program in 2020, and right now we've ran 8 cohorts of this program. We have over 140 graduates as alumni of this program. And this program, the main qualifier is that you have to be at or below ALICE, and the numbers are, I guess, the demographics of our alumni are representative of the demographics and data I just showed you on the ALICE report, because around 74% or 76% of our participants are women, 70% are women of color. Within that, people of color, and it crosses both the rural and urban divide and communities as well. And this program is 8 weeks long, focused on everything from business basics, mentorship, and there's actual seed investment and grants allowed or given out to each folks here to allow them to further pursue the development of their business idea. Next slide, please. We launched 2 business programs, one called Ascend, which launched this year. This is a program focused on Hispanic Latino entrepreneurs. This is a 6-month cohort program. So one and all is more for the ideation phase. You're looking at planning and want to get into launching a business, while Ascend is for those that are actually in business. And with this program, it's 6 months, we're looking at enhancing both their revenue, their prominence, and access to capital. So we did research on the Hispanic Wealth Index and found out that Hispanic Latinos have a harder time now historically than ever before actually accessing capital from major lending institutions. They're the second highest growing entrepreneur rate beyond Black women as a demographic. If you put Black women as one, then Hispanic Latino is the largest, second largest group together. Both genders are all genders included within that program for Latinos and Hispanics. So this program we launched this year to make sure we have programs that fit different folks and address the needs we've done research on within the economy. Next slide, please. We also continue forward for our Elevate program, which is in its 3rd year now. This was our region's and the state of Michigan's first Black Business Accelerator program. We know that the economy works best when all folks are able to participate in the economy, and Black folks are a driving force in the economy as a whole. So this program is similar to Elevate, or similar to Ascend, where it's 6 months, but the focus here is on revenue, profitability, and prominence. We know that a lot of businesses can make money, but how much money are they keeping, actually growing their position? So profitability was a key one when it comes for Black businesses. We saw a lot of money coming in the door, but actually look at internal operational studies and best practices to incorporate wealth saving or cash saving and wealth generating practices to establish businesses for the long haul and the long growth strategy. And so that is Elevate. Next slide, please. So policies of the future. Right now, LEAP's currently involved in a child care study. We know that child care is a major driver when it comes to the economics of a community. The lack thereof can cripple the growth of a community if there's not ample and affordable and accessible child care options out there. So we're doing that, but as a whole, for us to consider when we talk about building this together, as Angela mentioned, universal child benefit. If that everybody has access to both a stellar and affordable, great child care offering where folks can feel comfortable with their kids are being both looked after as well as taught, that creates a level of calmness and a level of security and stability for the parent to enter the workforce in a more productive way. So we're looking more into the child care study for our community, as well as a policy. We're not necessarily advocating for universal child benefit, but this is more of a progressive policy that can be looked at as a whole. Community hiring. We attract large industry to the community as the EDL here. And we always make sure that those opportunities that are coming to the community are being filled by folks in the community first. So one of our major projects is called Altium, which is a battery cell manufacturer here. We've engaged in a first of its kind relationship. We're helping Altium market and connect with local community to make sure that local folks can have access to those jobs and positions that Altium is offering, which are at a prevailing wage and have stellar benefits as well. And so making sure that when we land a project, that people in the community can actually work and get employment and occupation within those projects is about community hiring. Then lastly here is when it comes to fair chance of licensing protections. So when we talk about intellectual IP or actual new ventures being formed, we look at how are things being licensed out or approved for those ventures, and understanding that there's a review council or committee to make sure that there's a diverse number of folks on those boards that are offering these protections are another potential ways of looking at furthering a more equitable and inclusive economy as a whole. And I went through this pretty fast because I make sure we had enough time for Q&A at the end for everybody here. But these are some of the policies that LEAP is looking into the future, but more or less that us as a community should look into as a whole, because we really want a community where that we all have access to the benefits of prosperity, which should be, should be an inalienable right in itself. But that's what we want for the future for the Lansing community. With that, Angela, that is my overview of economic justice.
Thank you so much, Tony. And yes, we're going to keep it moving. We are actually just about at time. So just really quickly, we have these teams and we want you to think about where you can be a part of it. Is your passion in relationships? Are you interested in becoming a circle keeper? We want you to be an accountability partner. You've heard from institutional leaders who are committed to this work. They need community. As a community partner, we are an accountability partner. We bring our voices, our people to the process. Next slide. So this is the call to recommitment to all of us. Let's recommit to TRHT. We're looking for regional recommitments to the My Brother's Keeper Challenge so that we are tracking progress for very specific outcomes for our youth. To connect some dots between the health department, the community health improvement plan, and economic development, there is data that shows that communities that have higher economic mobility have much lower violent crime. So the way that we actually improve community safety is by making sure that people can actually earn a living wage and make ends meet so that they are not dependent on systems. Again, getting to the root causes. So we want you to contribute to the Ingham Community Health Improvement Plan. We want you to walk with us, to take this journey with us and commit to REAP for the next year. We will continue inviting municipalities. We will continue inviting partners to join this process. Next slide, please. We made it. I said we might get out early, so it's only 2 minutes. But so quick question. So are there any members of the media who are currently in the chat who are still here or joined us? If you can please raise your hand. Okay, it looks like community and our municipal partners here. So that's great. Okay, so we are going to close this out. I want to thank you. So is there anybody that actually does have a burning question, since we do have like time for maybe one question? We timed this so that we would be shifting into media questions after this, so you all can be the media, and I also want to honor the time, so if you need to take off, please do. Okay. All right. Thank you. Oh, Miranda's got a question and we're going to stay. So if you need to go, please feel free to do so. One Love Global, MPHI Health Department, LEAP, we all thank you for being here. All right, Miranda, go. Can we get you?
Oh, I was just wondering, because I didn't register for the this event today. I was wondering if I could get the replay.
Oh, absolutely. Yes, we're actually going to, so this is going to be posted on social media as well as sent out to actual media. but again, I'm going to say this and I'm going to say it on camera because it is so important. We talked about narrative and how important narrative and how important media is in this. So it's going to be aired on, it's going to be on the One Love Global page. It was going to be on the Lansing People's page and other places. So just keep an eye out for it because we are actually going to share the entire video. It's a bit long, so we may cut it into pieces, but it will air at least once in its entirety. So just keep an eye out for it, Miranda, and please drop your contact information so that we also have it. If you wouldn't, and if you don't want to share it publicly, just send it please to Danielle directly. Any other questions?
Angela, this is Dana. I have a question for Tony with LEAP.
Tony's still here, so you should ask him.
So
I am.
thank you. Tony, I just missed the in-between part on community hiring. So can you tell me in a few sentences what that was about?
Yeah, so community hiring is the policy or the practice of making sure when a new company comes to or sets up shop within the community that they are being proactive when it comes to proactive and intentional when it comes to making sure that local residents have the opportunity to work there, as well as attracting its own and other potential laborers and workforce from other communities as well.
Yeah. Thank you. And it's something that is separated from like current employers or how we talk about policing and how maybe like our police don't represent people that live in the community. So it's about the newer employers, but not really about currently, like Ingham County.
Right. It's more, the way we look at it is more towards our attraction efforts, that if we're attracting a new company to our community, or we're helping to make it, make sure that they are being intentional with getting a diverse representation from our local community into their workforce.
Great. Thank you.
I appreciate the question, Dana, too.
It's an excellent question. It goes back to that slide on the 20th century policing survey. It was one of the things that community really wanted. They wanted there to be some incentive for police to live in community, and it was one that no police departments were willing to do.
That's unfortunate.
It is, but we can continue the conversation. We don't stop. We keep it moving. Well, any other questions? It's so good to see you all now that the slides are gone. I'm glad that you are still here. Thank you so much for joining. And I hope that you are all ready to make this commitment to join as a community accountability partner to support our municipal leaders in doing this really important and challenging work. All right, any last words from our partners or anyone else before we close this out and stop recording? All right, have a beautiful rest of the day. Enjoy the sunshine. Thank you so much for being here, and keep an eye out for this recording and share, share, share.
Thank you, everyone. Take care.